This is Dr. Silvester, and I'm going to show you how to split a dressing. Sometimes we have patients that are after surgery, their foot swells up too much and they have a lot of pain, and so they call us and we tell them to split their dressing. So this is for those kind of patients that have too much pain after surgery. A lot of times this will take care of most of the problem. Now, it's important that you know kind of where your surgery occurred. Let's say this patient had something done on the inside of her foot, so the incisions are going to be over here. You want to try and stay away from the incisions. Once in a while they'll have multiple incisions on the top of the foot, and so you'll want to do the splitting down here on the bottom of the foot. This is just a regular pair of scissors like you might have at home. The first thing you want to do this is a very dull pair of scissors like you may have at home. So this is a very realistic video. So you see me splitting this dressing, and if you look, as I'm splitting the dressing, it's popping way open, okay? So we can tell that this one's pretty tight. See how much that popped open? And that's just the outside. Now that's not complete. This is what some people will do, and they'll think, oh, it feels better. That's not what we mean by splitting the dressing. We want to make sure you get right down to the skin, so it's important that you go all the way down. You know, I'm doing this with a terrible pair of scissors to just show you that it can be done. Try not to have the tip of the scissors go into the patient. Now, okay, so that's split now. See how much that popped open? That dressing was on pretty tight. So now, what we tell people to do is to not just leave it on. You don't need to do anything else. Just take some tape and close it up. Okay? So here's, and it's okay if it looks terrible, that's alright. We're just trying to get some pressure off the foot. Now the danger of having a dressing on that's too tight is you can end up with some real serious compression sores and a lot of delayed wound healing and a lot of problems. So if we tell you to split the dressing, make sure you watch this video and do it right. Make sure you get it split all the way down so that all the pressure is off the foot so the circulation can restore itself. And that's fine. We don't care if it looks bad like that. If you want to put some more gauze around it or something, that's okay. But all we're after is pressure off the foot. But that's splitting a dressing, and what most people notice if they have to do this, as soon as they've done this, their pain level goes way down. Thank you so much for watching.